Okay. Welcome everyone to the East Lothian Integration Joint Board meeting today, the 26th of March. I'll hand over to Becky to do the admin stuff first. So, Becky.
Thanks. This meeting is being recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are the data controllers under the Data Protection Act 2018. Data collected as part of the recording will be retained in accordance with the Council and Health Board's policies on record retention, and the webcast of this meeting will be publicly available on the website for 5 years. In terms of apologies, we have apologies from Patricia Cantley and from Councillor Finlay, and we have Councillor Maguire attending as a substitute for Councillor Finlay. So have apologies from Claire McIntosh. And I'll do a roll call of attendees. Andrew Cogan.
Present.
Councillor Akhtar.
Present.
Jonathan Blaseby.
Hello, good afternoon. Yes, I'm here.
Elizabeth Gordon.
Present.
Councillor Allen.
Present.
Councillor McFarlane.
Present.
Councillor Maguire.
Present.
Thank you. Maureen Allen.
Present.
David Binney.
Present.
Darren Bradley. Don't think Darren Bradley's joined us. Lindsay Byrne.
Present.
Sarah Gosner.
Present.
John Hardman. Don't think John Hardman's been able to join us. David Hood.
Present.
Kalonde Casangeli.
Present, thank you.
Liam Kerr. Don't think Liam Kerr is with us. Claire MacDonald. Mike Porteous.
Present.
And Fiona Wilson. I think Fiona Wilson has joined us. Thanks, Fiona. Can I check for any declarations of interest, please? There don't appear to be any declarations of interest. Thank you. Happy to move to the first item, Chair.
Right, thank you. I'll just do a welcome to members of the NHS Lothian Talent Management who are attending to observe today's IJB. You're very welcome. So hope you gain some insight from the conversations that we're going to have over the next couple of hours. So thank you for that. We're going to move into the formal agenda now. So we'll do the minutes of our last meeting, which was held on the 26th of February. So we have an action log, but we'll quickly go through the pages of the minutes, and please hands up if there are anything that you want to raise on page 1, on page 2. I'll just raise something there. I'll do mine first, Shimeen, then I'll bring you in. I think we've had one expression of interest so far in the service user representative, but I'm not sure if that has yet resulted in an application. And I think the advert is still open. Fiona, have you got any further updates on that?
Yeah, I'm aware of two that we've followed up, but I think one just through a good conversation isn't progressing. I think the other one is, I'm not aware of any others, but I think just going out to the couriers made a difference. So thank you. That's
great. Thanks, Fiona. Shireen?
Thank you, Andrew. It was on page 2 under section 2, entitlement to breaks for carers. I wasn't sure where it was the best place to raise that there's a consultation that's been announced by the government. I just wondered if that would be covered around our feedback and contribution towards that. That's important that we submit a response.
Fiona, has that come through the offices yet?
I'm looking for Laura, who raised hands up. Thanks, Laura.
Sorry, Andrew. Yeah, so aware of the consultation from an HSCP, I guess, perspective, we will make that response through the Carers Programme Board. If the IJB want to make a response as well, we could look to support that. I know we've done that previously with other consultations. So if the IJB want to make a response from the IJB, let's see if we can. There's echoing. Someone needs to be on mute. Then yeah, we can facilitate that.
Shireen, I think it will be good to at least for members to see the paperwork Laura, if that's okay, so we can make a response as required.
Do you want, how do you want, should we do that through Becky? Shall I just pick that up? And have
Please,
Becky to do
yeah.
that? Yeah, will do.
Okay, any more items on page 2? I see no hands. Page 3. Page 4. Page 5. Page 6. Page 7. Page 8. And lastly, I think it's lastly, page 9. Shamin.
Yeah, thanks, Andrew. Just at the bottom of page 8, we had quite a lot of discussion around the medicines, and the colleague who'd presented the report asked around making a response to Scottish Government. So I just wondered where that was sitting.
I can follow up on that. I haven't since the meeting. I know there was enthusiasm, and the feedback I've when she's gone back has been enthusiastic with the Midlothian CFO. So I'll pick that up just to where that's gone. Even if it's in the course of the meeting, I'll feed back if that's helpful.
Thank you.
Great, thanks, Fiona. I'm seeing no further hands, so we'll just quickly go to the action log. The first action there is action 0126, and that's predominantly in relation to the actions from the strategic plan and the development of the annual delivery plan and items therein. And I'm pretty certain it says June there, but I think the ADP is coming to the May meeting. Yeah, I think it's the May meeting. So, but correct me if I'm wrong, but all of those actions are due to be picked up through the annual delivery plan and performance reporting therein. Have I missed anything there, Fiona? Oh. No. Maureen?
Just a quick question around obviously performance framework under review and partnership recognition was flagged on that as well. So I'm wondering, is there any way that we can incorporate the contribution from the sector partners and community activity within the new one? Don't know, Claire, is that worth a conversation?
Yes, I think that would be really helpful, Maureen. So at the moment, I'm going through the strategic delivery priorities and trying to map some performance indicators against them. And I had a query beside the one about recognising and reflecting the role of the third sector. So it's on my list to have a chat with you about that. Thank you.
Great. John?
Yeah, so just on the timing then, just to sort of clarify. So the draft annual delivery plan is coming in May. Is that the idea? Because obviously this is quite a critical piece of work, right? And links into the budget discussions later on in this meeting and the recently agreed strategic plan in terms of what we've said we are going to do, and kind of so the actions that are needed, you know, to this committee board to be thinking about is quite critical, isn't it, in terms of the next 12 months plus. And so I'm just trying to get a clearer kind of how this all knits together over the coming 1 to 3 months from a delivery perspective, matching with the strategic and matching to the finance piece as well. I know this isn't on the agenda, but I just if it's possible just to briefly explain how it fits together in the coming months.
Well, I'll hand back to you to.
So I've got in my schedule to aim to have an advanced draft of the annual delivery plan to go to the May meeting of the SPG, and then on to the May meeting of the IJB at the end of May. Alongside the performance framework will come probably as an earlier draft to the SPG in May. So the annual delivery plan, because that is a piece of work that needs to come first, and then mapping the indicators against it. But we'll still bring a draft to the May meeting of the SPG, and depending on whether it is in an advanced state by the IJB at the end of the month, we'll bring it there. If not, we might wait and bring it in June. So there's a bit of development work in and around it, but we're all in hand at the moment.
Thanks. And how does that link in with the finance piece. I know in Mike's paper later, he talks about he or the group of officers is coming up with some various options in relation to costs and service delivery, etc. So that obviously this is an important piece of this. So is that all coming at the same time?
So these proposals are some of the items that we discussed at the IJB development session earlier in the year, and other proposals will be part of the annual delivery plan. And it may be at this stage we're still working up visas, options, appraisals, and so on, lining up the financial information, baseline data, and so on. So that's the plan.
Okay.
Claire, I'm sure you would take up Jonathan's input to any of these conversations. I know, John, you don't sit on the SPG, but I know you've got you raised a number of issues around this. So I'm sure, Claire, you will tap into John if you, and I'm sure, John, you'll agree to that, just to get some further input to this outside of the formal processes. John, are you okay with that?
Yeah, that's fine. I think the more we talk about these issues, options, etc., before we come to formal meetings, the better.
And we have certainly a number of development sessions over April and May, so I haven't got the agendas for them in front of me, but I'm sure we can incorporate some of the thinking around that as well. Okay. Any more conversation on that? No, there was a couple of other ones there. 26 was around the communications and engagement, and for some information to be sent to IJB members, and best value annual compliance review for Mike to consider issues within that, and I think they're kind of in progress. So unless there's anything more on that, we'll take them as an accurate record of meetings and actions therein. I'm seeing no hands, so we'll move on to our first substantive item, which is, I think it will be straight to Lindsay, the Chief Social Work Officer's annual report for last year.
Thank you very much. And good afternoon, everybody. On behalf of the social work professionals in East Lothian, I'm delighted to introduce the Chief Social Work Officer report for 2024-2025. So Section 45 of the Local Government Scotland Act 1994 sets out that every local authority should have a professionally qualified Chief Social Work Officer, and there's a statutory requirement for them to produce an annual report about the activity and performance of social work services across the Council and the Health and Social Care Partnership. The report reflects the breadth and complexity of service delivery across children's social work, justice, mental health and adult social work services. It provides an overview of the professional activity for social work in East Lothian through the delivery of our statutory functions in relation to the care and protection of people. The Chief Social Work Officer is responsible for the governance of the profession in East Lothian, and I work closely with service leaders to ensure I'm in a position to offer assurance to elected members, the IJB and the Chief Executive. This report is an opportunity to highlight the efforts of our social work and social care workforce who work tirelessly to protect people from harm and to support them to live safely and as independently as possible in their own homes and communities. Social work services have a wide range of statutory duties, and continuing to meet these in times of extreme financial pressure remains a challenge. As Chief Social Work Officer, it's my job to assure members about social work practice in East Lothian, but also be open about the significant challenges the profession faces as a result of growth, demand, and as well as the ever-expanding national policy expectations. But it's equally important to use this as an opportunity to celebrate the many achievements from 24-25, which are the result of an extremely dedicated workforce who are constantly trying to improve the way we deliver services. It's always beneficial to take time to reflect on our performance, explore and be honest about where we can improve, and to make space to recognise our achievements. The report brings the importance of the social work and social care workforce into sharp focus, and I never take for granted the skills and commitment of our staff who regularly go above and beyond to meet the needs of the people that we serve. So I'd like to take this opportunity to convey my gratitude to them, the relentless passion for the work that they do, and for continuing to make East Lothian a place that can take real pride and assurance in our social work and social care practice. IJB today is asked to note the content of the 24-25 annual report and its implications for the provision of social work services in East Lothian. and their role in assuring the safety and welfare of vulnerable children and adults across the county. I'm happy to take any questions, and there are other colleagues here from Adult Services to assist. Thank you.
That's great. Thanks, Lindsay. And I know this is the second one you've presented in relatively short order, so I think we're kind of back into sequence now. So I shall open it up to any questions, observations, comments from colleagues. A few hands have gone up, so we'll start with Maureen first.
Thanks, Andrew. Lindsay, I suppose just a quickie for me, obviously the demand is growing, and we know that the resource is shrinking. I suppose from a third sector community point of view, has there been any kind of assessment done about our capacity to pick up some of the demand? Do you know what I mean, if we're looking at a whole system approach, does that make sense? And how we support that moving forward?
Yeah, thanks for your question, Maureen. I'd probably look to a colleague from the Health Social Care Partnership to talk a bit more about planning and integrating with the third sector. I don't know whether that would be Isabel or Claire or Laura want to come in to support with that question. Isabel, thank you.
That's something we mentioned that's beneficial, that we're going to be looking that we need to do, and that is about improved collaboration with the third sector. And I think we've recognised that we're going to work to strengthen. It's in the report, Maureen. Sorry, I've not got the page up, but about our strengthened partnerships with the third sector organisations, certainly to expand community capacity and enabling a greater proportion of individuals to receive support. So that's what we've started doing, and that's what our plan is going forward. We can't do it on our own, we know that, and that would be that's our aim, to continue to do that.
Thanks, Isabel. I suppose, I mean, it's obviously the next question's round about funding and capacity building and that, so I would be really interested in when you have any discussions to be involved, because I think there's definitely something around about that.
Yeah,
you know,
I mean,
if we're shifting the demand, you can't expect the third sector to pick up for, with no resource.
Yeah, I mean, we are working, for example, at the care, in terms of care at home, we're working well with our third sector partners to look at how we dovetail together, and what areas they cover, what areas we cover, and we've got meetings going on, regular meetings going on every couple of months to look at that particular area.
But that's capacity, Isabel. Do you know what I mean? That they're independent providers you're referring to. What I'm meaning is the community capacity. So the families are picking stuff up, the organisations that are maybe picking stuff up, like the day centres, the meeting. Do you know what I mean? That kind of thing needs to be thought about as well when we're looking at capacity building and reducing statutory services. So as I say, I would be interested to further that. Thank you.
Okay, thanks.
Laura, do you want to comment on that specific work? And then we'll go.
Yeah, I think it's just to highlight what Maureen's saying. I think when we're talking about third sector involvement in relation to social work, it is about that earlier intervention and that prevention, rather than replacing a statutory service. And I think Maureen's right that meeting centres, day centres, community first, etc., where we're really wanting to see an increase and the demands that puts on our system, but that's where we want to focus a lot of our care to take that pressure off the statutory service. But note Maureen's point and our old adage of financial ability to do that and to support the third sector and properly to help them support and take that pressure off the statutory services. So yeah, Maureen noted, and I think we do it, and we can always do it better, and we're always looking at ways to continue that work we do with you.
Thank you. I think plenty of hands up, so we'll carry on. So Elizabeth next.
Thanks, Lindsay. I'm having connectivity issues. Can you hear me okay?
Yeah.
Great. Thank you. I just wanted to ask, a couple of times in the report, there's mentions of retention issues, and that's a priority for next year in terms of retention of staff, going forward, retention of staff. I'm just wondering, do you think there's a particular problem in East Lothian with that, or is it a national issue? Just wondering if you had any comment on that. Thanks.
Thanks for your question. I mean, retention of staff is always something we're particularly focused on. I'm quite confident it's not an East Lothian issue. It is a national issue in terms of workforce planning and how staff feel able to commit to jobs in the longer term. One of the issues in East Lothian, which is actually a kind of good and bad news story, is we have a number of staff who apply for promoted posts and achieve promotion. So we're not retaining them in the initial post they applied to come into, but they're actually progressing in the organisation, which is good news, but also then more difficult to fill the spaces beneath that. But there is a new workforce planning group for both adult social work and children's social work, which is focusing on improving staff wellbeing and support for staff wellbeing. There's also a new supervision policy that's been rolled out across the social work services, both in the Health and Social Care Partnership and within the Council, to really focus on how we can support staff to get the most out of their work-life balance, as well as their training and development opportunities, because we recognise that people can choose where they want to work, and we want to make East Lothian as attractive a place to be as possible. We've got a good track record, but we're always talking about what we can do differently and what more we can do to try and make people stay in these jobs for longer. Fiona, did you want to come in on that?
Yeah, thanks, Lindsay. Not that I'm the expert social work here, but I suppose the other thing that Isabel and I have been in conversation around is we believe we're a really attractive organisation. Is there an opportunity with those graduating? Could we do similar to what NHS Lothian have done around nursing? And I think midwifery, Sarah, models of recruitment, and can we look at potentially over recruiting that then would support? So we're just working that up, aren't we, Isabel, around how we could do that to discuss with kind of partner organisations who's the employing organiser, but recognising the value of social work. We do have turnover, but can we be a bit creative around that recruitment aspect, given we know people are coming out imminently? So why wouldn't we want to take them and shape them for East Lothian and to the benefit of the people we support?
Thank Elizabeth, is that okay?
Perfect, thank you.
I'll take Carol next.
Just about quicker discharge. We're building more homes either with adaptations or with the ability to easily make adaptations, help quicker discharge from hospital and make it easier for social workers and care staff. There's a lack of these type of houses in East Lothian, and I was wondering if we could persuade private builders to build more, that would help a quicker discharge for hospital.
Thanks, Carol. Fiona, and you come.
Do you want me to come in? So yes, in part because we need flexibility around housing. I suppose that's not the only answer, because with that comes lots of other things. But yes, there's an element of, if we had flexible housing, particularly in the interim, to support hospital discharge, that would be helpful. Our housing colleagues work well with us. And I think that the challenge is availability versus that discharge date. But what we've tried to explore even in East Lothian is around other alternatives, partnering up. So Lukey House have supported us around discharging to enable access. But absolutely, Carol, you would welcome that kind of flexibility, housing being available. But again, it's back to the person's choice too. That comes into it as well. So what we would want and the person might want is completely different.
All right, thanks, Fiona.
Okay. I'll take Jonathan next.
Sorry, me? Yeah. Yeah, thanks, Louise. A really interesting report. I know we've had conversations before about timing. I mean, this is now at the year end, and so it's almost a year out of date, this report, and I think that's unfortunate, and I'm hoping that these can be done a bit more promptly for the IJB. And I guess my first question is kind of, given that we're actually at the end of 25-26 already, it'd be interesting to get your thoughts on how we've done this year, because obviously the data we're looking at here is a little bit stale. I know there are priorities and objectives in here for 25-26, but I assume that they were written a year ago. They're not just being recently written for this year. I would assume that. But really, I'm trying to get a sense, really, of what the trends are here, because when I look at the kind of the narrative here is around increasing demand for services, but I don't know that I see that in the report. I mean, adult referrals have decreased by 8 or 9% this year, and they're back to where they were 5 years ago. Interagency referrals are down 40% than they were 4 years ago. The children on the child protection register is nearly half what it was 2 years ago. Which actually, I'm not saying it's a bad thing. Actually, I think that is a really good sign, really good thing, and I think it's an indication. I think of there's many comments in the report around actions that have been taken around training, which looks really good, better improved training compliance, the development of a newly qualified social work program, changes in process redesign, system change. So actually that's good, right? And it seems like that because of that, pathways changing, etc. It feels actually that the referrals are actually and the demand is actually decreased, but the narrative in the report is around increase, and I mean the cover letter talks about an increase of 8% in adult referrals, which isn't the case, because in the report it's actually gone the other way. It's 8% lower. So I'm just actually, I think it's a very positive thing in that sense, but I can't quite understand, is it an increase in demand or not? Because it feels like based on the data last year it's actually come down, which again is a positive thing. So I'm interested in knowing if that's kind of the longer term trend, and what we've seen this year, whether there's been a change in 25-26 and what you look at the moment, because this is important in relation to planning for service staff numbers. And sorry, and my final point would be, I think next report, Lindsay, it'd be really helpful if you could kind of triangulate the workforce caseload data in this report. There was no data here in relation to recruitment, in relation to retention, in relation to staff numbers and caseload numbers. And I think personally that'd be really helpful to kind of triangulate kind of the referral piece, demand piece, and the demands on our staff in terms of dealing with that workload. I think that would kind of knit this together in a clear way for me. So I don't know if those questions made sense. Sorry, I've got a couple of other questions as well, but I'll sort of stop there. Thank you.
I'm trying to pick out the actual questions in amongst that.
No, my
Jonathan,
question is,
what I would say is I don't set the timetable for when the report is due. So the report is due to Scottish Government the October after the financial year. There is sometimes a delay with data, because some data cycles are slightly later than that. So I don't currently have the data sitting for next year's report right now. So I can't talk with any confidence about trends on this current year's data. So it's the Scottish Government that sets that, and in terms of the content, they also dictate what should be in the report. However, what I would say is I suspect that's going to change this year. Because with the introduction of the National Social Work Agency, they are looking to review how we annually report on behalf of the Chief Social Work Officers in Scotland. So I expect that this format may change this year. And if not this year, certainly next year. But I'm always happy to take suggestions of what would be helpful. And I'm also really interested in caseloads versus workforce. I think it's one of the most important things we look at on a day-to-day basis. I find figures of referrals and demand into services, it fluctuates all the time. We can see changes. So for example, you're talking about the child protection register, that's now gone up. It's probably double what it was in this report. And we're always asking questions, why is that? What's driving that? But things can change quarter to quarter, month to month. And what I'm continuously told by frontline workers is that the level of complexity coming into social work services right now is completely different to where it was pre-pandemic. So I know the pandemic was a long time ago now, but people are talking about these multifaceted problems that are coming in. It's not just someone needs X, they need X, Y, and Z and support for a number of things that underpin their life. And the level of complexity, the level of trauma that people are experiencing, so the level of support they need is completely different. And that space of adult support and protection, that's become extremely complex. It always has been, but that's an extremely complex space. The world of guardianship, mental health, nothing's getting easier. Our communities are really struggling, and they struggle in a range of ways, particularly with mental health problems, addiction, poverty, I've stopped calling it a cost of living crisis, because I think a crisis has a beginning, middle and end. People are just struggling. And that shows. It shows in people's presentation at the front door of social work. And, you know, we do rely on trying to build up really robust community-based third sector services to help support communities, both in adult services and children's. But ultimately, when something becomes a statutory demand, it is then down to us to intervene. So I don't pay too much attention to the numbers, but about what our workforce are feeling. And what they feel is that a case doesn't equal a case. You know, we talk about caseloads. You can have 10 cases that are, you know, relatively straightforward to deal with, or you could have 5 that are really complex and take up the vast majority of your time. So me understanding that and working with our managers what I'm looking for is assurance that our workforce have got manageable and safe caseloads, because the moment I'm getting told that they don't, then that's my responsibility to try and do something about that. And we're good in East Lothian about having these honest conversations. So yeah, I get frustrated at the timetable too. I think it's quite, you know, I mean, we could have brought this to the last IJB. Granted, we're 4 weeks or a month behind, but I don't set the timetable from the Scottish Government. I don't set what they're looking for, and I do think that'll change going forward. But as per demand, I can say with a lot of confidence that our frontline staff are not feeling any kind of nominal dip in numbers, because the level of complexity is remains significant. I notice that Isabel's got her hand up. I don't know if you want to come in and supplement that, Isabel.
Yep. Jonathan, you'll see, I mean, I would support what Lindsay's saying just in terms of the complexities of caseloads. You know, I'm working with about 4 cases where we've got team managers involved, I'm involved, and others are involved because of the complexity. So the complexity of the cases are really increasing. But you'll also see within the report, Jonathan, we've got workforce groups in both children and adult services, and these workforce groups all kind of look at recruitment, retention, caseloads. So we use tools for caseloads, like Setting the Bar was a report that was done by Social Work Scotland, you know, about what caseload should be, and that's part of it. So our workforce groups collate all that information and look at all that stuff, along with the mental health and the well-being stuff, and we kind of do reports at that. We do audits. As Lindsay said, we've introduced the new supervision policy, and some of that I think we've given in the report what our achievements have been, and that. And the other thing is that there's also the SSC reports, the social work, the Scottish Social Services, they produce annual reports, and you can see how we in East Lothian compare to others. So we can give you that information, and kind of that information is certainly available in different ways and through our workforce group, our workforce groups. The other thing that we've got in adult social work at the moment is we've got a performance framework where we're measuring all our statutory responsibilities. We've set targets against that, and we've just done this year, started to do this, and that's been seen as really good practice, and how we're measuring that kind of going forward. So that's some of the things we're doing in adult services and across children's services as well. But we've got that. We don't not have it. It's quite important detail to have and to be working to, but it's what you're bringing into the IJB and what you're not really as well.
I think there's in my perspective, as our financial challenges become greater over the next 5 years, and if we are having to use data to guide our strategic choices, we need that data to be as accurate and reflective as is possible, because we don't want to say, but the data's wrong, or the data's got something else. If the IJB over time is going to be using data to make decisions, I think it's incumbent upon officers and others to make sure that the data that's in reports is reflecting the realities of some of the decisions that we'll have to make. And I'm not making that just in relation to this report here. I think it's going to be in terms of everything. And I know, Lindsay, you're hamstrung by what government are telling you that you should do, but when it comes to future decision making, I think all data that is presented needs to be as robust as possible. John, you said you had some further questions on that.
No, that's yeah, no, I totally agree with that comment, overarching comment, Andrew. I think if the data, if information provided to IJB is too blunt in a way, and it's not nuanced enough, I think, you know, to look at caseload and complexity, then the question for us is how do we influence a change of that, you know, as well as not just a timely change to get reports, you know, done in a more timely manner, but also influencing actually to make them much more relevant to us, so we can make the right decision making. It concerns me if that's the case, that if we have to present data that isn't as useful as it perhaps could have been, because actually it doesn't tell us the real story of what's happening in the service. And I guess that was, you know, and I think you've explained it, Lindsay, in as well term what is happening. So it's hard, isn't it? It's hard, and trying to get the information to us as IJB so it can give us information is tricky if you're hamstrung by what you're allowed or can tell us, and if the data is not even available to you. And isn't, I mean, I can see in this report there's data which is missing here for 24-25, just blank. So you haven't even received that, and that's 12 months out of date. So I think that's not acceptable. And I don't think we should accept it as an IJB and use officers to accept that position. But anyway, that's the system, I guess. But yeah, I've got a few other ones. I think you've been generally answering those as we've been going along, so I'll let others come in.
Okay, Isabel, did you want to comment on that point specifically?
I just wanted to say as well what you touched on there, Jonathan, about it being good news about the kind of referrals. I mean, we're doing a lot of preventative work here. You know, we've got a duty system that really measures well across the country. I mean, we've not got lots of people waiting on assessments. So we know that, and that's about getting people at the first point of contact. You know, they come into our duty system, we pick them up right away, so they're not on a waiting list for ages, kind of waiting on an assessment. We tend to think about 80% of the people that come into us, we pick up at first point to try and deal with that. So that's some of the work we're doing to try and prevent people coming into statutory services, trying to get that there. The SPOA helpline, which is the SPOA system, which has been set up, that's in the report as well. You know, that's about preventing people from coming into hospital and preventing them from coming into services, and trying to do that kind of, and, you know, keep them at home as much as we can. So it doesn't necessarily mean that reduction which you touched on, that reduction in numbers, it is around some of the work we're doing to try and encourage, you know, get people to stay at home, help people stay at home, stay out of the systems, and stay away from kind of statutory services if they can, and it's appropriate.
And hopefully that means that for the public, for the individual experience as well, right? It's not just about us and the system and the, you know, our workload. It's about, at the end of the day, it's about the individual.
Yeah.
So yeah, I think it's some good stories there. There's a good, you know, it's good effort.
I am going to move on for time. So Fiona, did you want to comment on that particular one?
Yeah, I guess I was just going to echo, and I suppose, Lindsay, it talks about responsibility to Chief Exec, but also for myself as Chief Officer, social work and the work that we have done together, the whole approach as well to MDT working and that kind of solution focused approach. We couldn't be without social work as part of that integral team, and I suppose just flagged up some of the opportunities that we've taken, and we're going to talk later about the unscheduled care money. But I'm just thinking, reflecting, just hopefully it just brings to life some of what Lindsay's saying. The work we take around reviewing, so care at home challenges, the care home challenges, all of that is an integral, social worker integral to it, but just even the planning, the discussion, I guess the work together through the MDT approach has changed over the last few years in a way I think that is positive to the population of East Lothian, and I hope that contributes to the data that you see, and moving towards that, balancing the prevention element as well as the here and now and the crisis work that social workers do.
Thanks, Fiona. I've got two further hands, and I'll then begin to move on from that. So Shamim next, and then Liz.
Yeah, well, thank you. Thanks, Lindsay and Isabel. Part of it you've answered was just to get across the complexity of the types of cases and the challenges people are facing, but you've clearly articulated that already. Just from the report, there's a huge amount. It's really, really helpful to have the challenges that you're facing and the demands and also the achievements is really important. Is there anything that you would say to the IJB as in the year ahead of really focusing on more so than other areas? I know it's a balancing act because all of those areas are important. If there's anything that a key message you would want to pass on to the IJB. And secondly, it was kind of more of a question for ourselves as an IJB of how we recognise and value social work and social care in our comms and our work that we're doing, and we're doing any work around unscheduled care or engagement with government, just ensuring that we're putting that high up on the agenda alongside all those other things, because it's not just a key service, it's a critical service for people, and we've kind of picked up why that's important for us in East Lothian, because sometimes people perceive East Lothian to be maybe not having levels of poverty or deprivation, but actually we know we do. I mean, and from the report, it's clearly growing.
Thanks, Shameen. I'd probably want a bit longer to think about what my one message to the IJB would be, but what I'm thinking about is, we talk a lot about what services we need to protect. We offer a range of statutory services, and we can't really pick and choose which one of those areas we want to deliver. We have to deliver all of it. But what I would say is there's some areas that will have a greater impact if we are not performing well in. And for me, performance is about having a sufficient and well-trained workforce. And that's where we really need to make sure we protect our services. We can't deliver things safely and well if we don't have enough of the well-trained people to do that. So that's, for me, the work that adult social work services and the Health and Social Care Partnership in general actually has done around workforce planning, as well as that performance framework, is really pivotal, so that we can be in a position to tell you exactly what it's like on the front line, exactly the impact of caseloads versus staff levels. So for me, it's about creating a workforce that can deliver the best and safest services for the people in East Lothian. We can't then, in amongst that, say this is more important than that area, because for people, the thing that's most important is the thing that's infecting them. So it's not easy for us to choose which of our areas of business are the most important, but to say, honestly, what will have the most impact if we don't properly sufficiently fund X, Y, and Z? What will the impact be? And being really honest about that, because we know there's really difficult decisions to be made. We know this is not an ideal climate, but you have a workforce that really care about delivering good outcomes for people, and that ability to do that will be diminished further if we can't manage to do it in a sufficient way. So for me, the bit about keeping an eye on the workforce, keeping an eye on how we support our workforce, the training required, how we link in with universities, all of that's going to be really important to make sure we can continue to offer high quality services.
Thanks, Lindsay. And lastly, I'll take this.
Thank you for that. I'll try not to be too long. I know that managing the workforce can be very difficult, particularly with numbers, if people are coming and then leaving, and it's not an easy thing to deal with at all. There are a couple of things. One is, is there something we could do that would stabilise the workforce in that way? I know there are things in office about work-life balance, but is there anything that we are missing? But also, are we having to use agency staff? I would guess we probably do. And if so, what are the numbers and the costs? That's it.
To your question, Liz, I'll maybe take the first half of that, and then I will be able to comment on the use of agency staff. I'll bring Isabel at that point, because obviously I don't have line management responsibility for these services. It's more about, my role is about professional governance of the social work and social care professions. I feel quite confident through a range of measures, including staff surveys during strategic inspection, our employee surveys annually, that staff generally feel well supported in East Lothian. There's a good culture of promoting flexible working where that's required, and I like to call it a kind of family first approach. We do accept that people have families and lives that run alongside their working lives, and we try and be as flexible and as accommodating as we can, whilst also getting getting the job done and making sure that business is met. So I do think it is a supportive and kind environment, and I think people comment about that quite a lot. People talk positively about the training opportunities they get, albeit that not everyone feels they've got enough time in the day to do the day job and the training and the expectation that are placed upon them. But I do feel quite confident that for the vast majority of employees, we do get it right, and we're not hearing feedback at exit interviews that it's anything to do with what East Lothian could have done differently that would have made a difference in staying. It tends to be about job opportunities, relocating for family, etc. We're not hearing things that we could then act upon. And Isabel has made sure that she's implemented exit interviews for everyone who's moving on for the organisation, so that we can have that opportunity to hear that feedback and put anything into action that we need to. In terms of agency staff, Isabel, can I hand that one over to you?
Yeah. So within adult services, so before I can't sign off agency staff, so we've got a system that it's got to go up to the to the operations manager, which is David. So I can't sign off agency staff, even at my level, if we've got to kind of put a business case to actually use agency staff. For the last year, I've not used agencies. I think I've used one member of agency staff, but I've just had 10 social work vacancies for a range of different reasons, but mostly kind of people moving, as Lindsay says, people moving up, or people just deciding that they want to do something different. Sometimes they go over to children's services, sometimes they'll go out with. So so recently, and I've had to support the workforce use agency staff. Now we only ever use them for 12 weeks at a time, and then we've got to get a review of that. So we're not on that never-ending cycle. We can't manage it within budget anyway. So I hope that answers your question.
Yeah, I'm really happy to hear those answers. That you know, that's well done. Really, that's tough to do. So thank you for the answers there.
Yeah.
I'll sneak a final comment or question from Shamim, and then we really do need to move on.
Thank you, Andrew. I didn't have a question, it was just more a comment. I didn't want to kind of not make a comment on the paper today. Just to thank Lindsay and Isabel for the report, but also the professional assurance that they give to us to the IJB. I think the reports are always really robust, and your contribution at development sessions are always really, really helpful. So it was just for the minute to pass on my thanks for that, but also to ensure that as an IJB we take every opportunity to raise awareness about the value of social work and social care and the work that we do, and in the different forums that we're in as we move forward. And I thought that you this year had a really good World Social Work Day at the John Gray Centre on the 17th of March. So it was great to meet other staff there and engage with them and just get an opportunity to talk to some of the services that make a big difference to the lives of people across East Lothian.
Thanks, Shamim. Echoes, I think, all of our thoughts there. So, Lindsay, final comment?
Just to say, if there's something specific that you're looking for to help with decision making, within the IJB, please do ask for specific topics to be covered. We don't have to wait for the annual Chief Social Work Officer report. It serves kind of one purpose, but if there's something you want that's more granular detail about a particular area, please do ask us and we can prepare that for an upcoming IJB. Certainly don't mind doing things out with the cycle of reporting if there's something specific that would be helpful.
Right, thank you. And as we progress, I'm sure we'll be taking you up on that kind of offer. Okay, before we move on, can I just make a gentle reminder to everyone to, if people have comments to make, can we make them through the conversation rather than by using the group chat? There's been a few, not complaints, but a few colleagues have mentioned, and it's in our standing orders that we do things through the meeting as opposed to the group chat. So just for future, if people have genuine comments to make, stick their hand up, and we'll include them in the conversation. Okay, we move on to the next item, which is the psychiatric emergency plan. Fiona, are you introducing this, or are we moving straight on to Karen? In that case, I'll welcome Karen to the meeting. Fiona, were you going to say something then? Sorry, no. Karen.
Go, Karen.
Okay, thanks very much, everybody. So thanks for having me this afternoon. So my name's Karen. Gosden. I'm the Nurse Director for Mental Health and Intellectual Disability in NHS Lothian, and I've been chairing a review of the Lothian Psychiatric Emergency Plan for some time now. Actually, the review has actually taken much longer than was originally anticipated. So the purpose of the paper today and the updated plan is to present to the IJB the revised multi-agency plan. So this replaces the previous psychiatric emergency plan, which was actually developed in 2013. So it sets out the principles, guidance and advice for all the relevant partners about the legal detention of patients in accordance with mental health legislation. So it sets out best practice to be followed in the event of someone requiring detention in hospital. And what I should say is, if I slip into jargon, please just flag to me and I'll explain anything that I've perhaps jargonised. What the PIP doesn't do is it doesn't attempt to provide solutions to the issues of resourcing within the existing services that impact on the operational delivery of the plan, but it does highlight a particular issue that has cropped up during discussions and during the review of the plan, and that's in relation to the transport of patients to hospital, which does require further consideration. So the plan has already been approved by the Lothian Mental Health Programme Board. The Programme Board has membership from each of the Health and Social Care Partnership Chief Officers. And in terms of the recommendations today, it's recommended that East Lothian IJB endorse that approval so that we can then implement the plan in East Lothian. And similarly, we're asking for that same endorsement from other IJBs and also the RIAS operating division of NHS Lothian. What we also recommend from the review group is that the Health and Social Care Partnership management teams undertake a review of their performance against the PEP and take actions to address any existing gaps in resourcing that potentially impact the safe and effective and efficient management of psychiatric emergencies. As I say, it's not for the PEP to kind of set out what the resources are, but that created a significant amount of discussion throughout the review process, so it was felt important to include that within the recommendations. To give a bit of background to the psychiatric emergency plans, these are basically locally agreed arrangements and procedures that outline the roles and responsibilities of health, social work, police, ambulance and other partners who are involved in responding to and managing any psychiatric emergency in the community, and at times within hospital premises as well. The aim is to agree on the procedures to manage the detention and transfer process in a way that minimises distress, trauma, harm and disturbance and risk for the patient and anybody else, but also ensures that smooth transition of the patient into hospital. They are comprehensively developed and locally relevant documents that are set out in legislation, and that's in terms of the Mental Health Act. So within the Code of Practice, it specifically states that each area should have a psychiatric emergency plan to really preempt any potential issues between agencies that might be involved in the detention of patients. So within the Mental Health Act Code of Practice, within paragraphs 49 to 58, that sets out the expectations and processes that are to be followed, and that's essentially what the psychiatric emergency plan attempts to translate into day-to-day practice. In terms of engagement throughout the process of the review, there's been a wide range of stakeholders involved in revising the plan, including all the relevant statutory agencies, representatives from third sector organisations, patient representatives, and I should say these have changed over time in terms of the timescale of the review of the plan. So there's been people that have come and gone during those years that have contributed to the review, and there's also been representation involved from all the various professions that are involved in the detention of patients. In terms of the policy implications, I've already mentioned the Mental Health Care and Treatment Scotland Act. The PEP also takes into consideration the Human Rights Act, and from a Police Scotland perspective, the Police and Fire Reform Act as well. another act that's considered in terms of the PEP is the Criminal Procedures Act as well. There hasn't been an integrated impact assessment. This plan basically is an update to an existing plan, and so that hasn't been undertaken at this time. In terms of the IJB directions that it's relevant to directions DC 1, 2 and 4. So that's the delivery of core primary and community health services, so providing community mental health services, community learning disability services, because the psychiatric emergency plan applies to both people with mental illness or people with learning disability, although that's under national review at the current time in terms of legislation. It's relevant to hosted services, so providing mental health inpatient services. As you know, the East Lothian adult beds are provided from the Royal Edinburgh Hospital. Old age beds are obviously provided locally within East Lothian, and any young people's hospital admissions for mental health issues are provided by NHS Lothian on a regional basis. And in relation to Direction 4, East Lothian Council delivery of social work and social care services, mental health officers are qualified social workers who are appointed under law in terms of statutory duty within the Mental Health Act. So that duty primarily sits within the Mental Health Care and Treatment Scotland Act in the form of mental health officers, which ties back nicely to Lindsay's report. It's also aligned to East Lothian strategic objectives. So the main objective it aligns with is Objective 6, and that's keeping people safe from harm. So I mentioned at the outset about resource implications. So the PEP in itself does not include within its scope solutions to gaps or shortages in operational resourcing. But as I mentioned, there's been very, very lengthy discussions about what resources people have as opposed to what the legislation sets out that we need to do in relation to the Act by all partner bodies and agencies in terms of gaps and how these impact on the efficient use of available resources, the safety and well-being of patients and staff and public. So in relation to that, it might be about delays in getting patients into hospital once a decision has been taken to actually detain them, or it might be in relation to who actually does the detention. So whether that's a GP or a Section 22 approved doctor, which means that they're approved under the terms of the Act to carry out detentions of patients under the legislation. In terms of financial implications, so again, related to what I've just said, it's not for the PEP to basically set out how organisations spend the finances. So the PEP in itself doesn't have financial implications per se, as all it's doing is setting out what already happens in practice. And I do apologise for some of the noise in the background. Operational services, we would recommend basically benchmark themselves how they are performing against the principles and practice contained within the PEP and identify any gaps in terms of any existing resources therein. And then similar to personnel, implications for personnel, this doesn't include an additional workload for any of the professions or agencies already involved in the detention of patients to hospital. But again, as I said, the process of the review has highlighted areas where there are gaps and where there's significant impact on clinicians and practitioners when they're trying to detain patients. So an example of this is at the moment, it's the Scottish Ambulance Service that are responsible for the transporting of patients to hospital. But that often incurs significant delays of many hours of time in terms of the availability of personnel and ambulances themselves. That in turn has a domino effect on clinicians. So for example, you might have a psychiatrist and a CPN, a mental health officer, delayed in a patient's house for many hours, or a GP, for example, who has to cancel their clinic that day because they've been called out to do a detention, and then there's a significant delay of at times 6-7 hours before the patient can actually be transferred into hospital. So it does have a significant impact on planned duties of clinical personnel, and when you transfer that into cost implications, then the cost can be quite significant. A point that I need to highlight is something that's come up recently, and that's in relation to Police Scotland have reaffirmed their policy position in terms of their involvement with mental health events. And historically, Police Scotland colleagues have been very helpful, very, very supportive in supporting health and social work colleagues to transfer patients into hospital. But as they've rightly stated, it should only be where there is a crime being committed, that there is any police involvement, or the suspicion of a crime about to be committed, for example, violence or disturbance. So with Police Scotland reaffirming their position on the law as such, that will have a knock-on effect on resources in terms of the availability of staff to escort patients into hospital. At the moment, we kind of steal from Peter and Paul to identify staff that can escort patients into hospital, but it does need proper resourcing. A further interpretation of the legislation by Police Scotland is in terms of their powers to enter private premises and to remove people for the purposes of detention. And the implications of that, there will be more requests from sheriffs and from justices of the peace for warrants for that to take place. Now, NHS Lothian have similarly sought legal advice on the interpretation of the law in relation to this. So that's currently with our central legal office, and we've been advised that they will come back to us on Monday with a position on that. But it's to flag it to the IJB that this is a potential issue that will have an impact on clinical staff in terms of that safe transportation, safe escorting of patients into hospital, and possible additional delays of police having to access warrants before they can take action. We have made inquiries with private ambulance provision via the NHS Lothian Flow Centre to explore whether that's a service that could be commissioned from a private ambulance service, which has been confirmed could be done. But again, it wasn't for the PEP review group to go through that process, because there would be a tendering process involved in that, and that would be for the operational units to consider. So I'll finish there, and happy to take any questions or any points for clarification.
Okay, thank you for that. I don't underestimate your challenge of producing a report that's both operational and strategic, and there's a lot of operational detail in the 101 pages that I don't think the IJB is intended for us, nor indeed can we offer comment on it, because it's clinical and operational. I'm gonna, before I go into colleagues, and I think Guy probably it's what is the implication of this for the IJB that's of interest to us. So Guy, would you be the one to answer that, or do I need to come to Fiona on that?
I mean, I was going to first of all express my thanks to Karen for presenting that to us today, and welcome the updated PEP to East Lothian, and to assure the IJB that we've been involved at the appropriate points in its development over the last few years from an East Lothian perspective. We work in compliance with it and recognise some of the pressures that Karen's outlined for us. Again, in terms of reassurance, within normal working hours in secondary care mental health, the escorting element is more manageable from a staffing basis. But we do also note that we have experienced instances ourselves where our patients or our clients are waiting for a great amount of time to end up at the right place for their safe and effective care. Of more interest for me is outside of our normal working hours, so the intensive home treatment team beyond 5 p.m. we would normally have a 3-1-2 shift pattern, so 3 in the early, 1 on mid shift, and 2 on a late shift. And so in the evenings, it's a particular pressure for us if one of our staff is going to have to escort someone into Edinburgh, because it leaves us quite short in terms of our ability to react to any other incoming emergencies within East Lothian. So working on mitigations around that is critical for us. At this point in time, we work in collaboration with Mid Lothian, and they're in a very similar position with having a small IHT. So we do provide cross cover with each other. So we work together to make sure that we have robust and safe and effective teams providing emergency cover across both patches. But I also recognise that we do need to develop further our solutions around this in the longer term.
Thanks, Guy. Isabel, next.
Yep, so well done. 1993 was the last one, as you said, was it, that it was reviewed? So well done on getting this through and done and finished, because it's 2013, right? Well, it feels like it's been going on since 1993, so well done for kind of getting it finished and over the line. I had a conversation about with John Hartman and stuff whether that would happen, but it's good to see it. There's a couple of things, I suppose. I'm just wanting to double check, because you did make mention once, but were MHOs, I know we were involved in it in the past, but we weren't necessarily involved, and we've just got the documents, so we're looking through it and having a look at that in terms of the MHO response, but also the MHO subgroup. Where our concern was around the policing powers as well that you talked about, because we used to go out with the police, and we had a slightly different statement from them on when they would attend, and it was if there was a significant and immediate risk to life or threat or imminent serious injury, if there wasn't such an intervention. So we've got that on an official policing partners kind of statement thing. So has that changed then?
So no, I've kept it very high level in the paper, but yeah, there is a statement that was issued by Police Scotland, and just as you described. Our difficulty is the interpretation of that statement, whereby we know that at times it will come down to individual inspectors or sergeants on duty as to how they interpret that. From a very black and white point of view, patients aren't detained under legislation unless there is a significant risk to the health or safety of themselves or others. So by the nature that they're being detained, there is a significant risk. That's our take on it. But I think in day-to-day operational practice, that gets interpreted differently by different colleagues. That's what we're taking legal advice on from Central Legal.
Yeah, because we've certainly locally seen, police would assist with removing a person, and there's been a reluctance to do that now. There's been a bit of a pushback on that. So that's locally what we've been seeing.
Thanks.
David, did you want to come in on that particular point?
No, not on that particular point.
Okay, I'll bring you back in a sec then. Shameen, next.
Yeah, no, thank you. Thanks, Karen. It was just to get reassurance of the governance of this, and that the appropriate individuals were involved in this to ensure that we've got that reassurance. So just to get some feedback on you on that one. And you've mentioned that through your discussions there were some issues picked up. We'll be, setting a budget later on, and you've mentioned some things around workload and gaps. I wonder if those will be picked up as you're working through this, as you implement this, to be able to go back and look at ways to get those addressed. But it was just to get that governance reassurance.
So in terms of the actual review of the document, there was representations from all 4 health and social care partnerships and various different professions. Specifically around MHOs, it was actually, I will say it was actually Edinburgh MHOs, so it was Audrey Graham and Ian Waite. But the expectation was that representatives from each of the health and social care partnerships would take it back into their local areas and get the views on it. So there's been lots of different representatives over the years. In terms of governance, so that the document has been developed multi-agency, multi-partner. So Police Scotland colleagues have taken it through their governance routes. Scottish Ambulance Service have already taken it through their governance routes, and they're satisfied with it. It also went to the the Joint Mental Health Improvement Board, which is NHS Lothian and the 4 health and social care partnerships. And it was them that made the approval on it, if you like, but it's now coming round to the IJBs to endorse that approval before final implementation. Implementation will be up to the local health and social care partnership to implement within their local area if approved.
Is that okay, Shameen?
Yeah, no, thank you. I think just to take on board Isabel's feedback that Edinburgh is very different from East Lothian, where, and the capacity and the level of resources locally. I know we're getting into operational, but I think it's really important to make sure that we're involving in such a delicate and stressful situation for the individual and for the people trying to support that individual. It's really important to get feedback from all levels, and maybe that's just something to take away.
Thanks, Shameen. David?
Yeah, and maybe just to touch on the point Shameen's raised there, and I think probably helpful, we've got into quite a lot of operational discussion in terms of some of the specifics in this, I think, which is helpful in some respects, but I think probably to put it into a context that this is part of the overall system approach to mental health and some of the pressures that exist at the moment. And there are a number of executive groups and forums that are actually tackling these things and picking them up on an operational basis in terms of what those issues are and engagement from that. And from a system perspective, we are actively engaged in those. So whether it's at the chief officer level or kind of at the operational level with Guy, or kind of some of the other levels that I'm involved in. And I think it's really helpful to have the kind of assessment that Karen and the team have done, because then that gives us the kind of the questions and the things that we need to answer from an operational perspective, and how we do that and how that links in with resources and the kind of strategic direction going forward, which I think is probably more relevant for this group rather than kind of some of the nuts and bolts in terms of operational decisions that need to be taken. But I think it's really just to put this into a context that is part of a wider conversation from a system perspective about how we support and provide safe, effective, high quality mental health services across Lothian, of which East Lothian at the moment does very well in terms of comparison, but actually just to provide that context.
Thanks, David. And I take it from that you're happy and supportive of the first recommendation that the IJB can endorse this, because it's been through the HSCP and all of those operational procedures.
From my perspective, yes. And I think that second bit in terms of the recommendation, I think is helpful as well. And we can pick that up and take that forward from a HSCP perspective and start to think about some of the questions that have been posed in terms of some of the challenges that maybe Guy, Isabel, Shameen, etc. have kind of raised throughout their questions.
That's great. Thanks, David. I'll take a last comment from John.
Yeah, no, thanks, David. I think that's right, because it's very, I mean, this is a very, very detailed operational document. I don't think we as the IJB can knowledgeably comment on it, to be honest, but we have to assume that, well, we do know we're getting assurance in terms of the governance route. So focusing on that, the second one, which is East Lothian HSCP's assessment of it, and perhaps that's actually when this should have come to the IJB, to be honest, is when that piece was done. A question for David, maybe, I don't know, is, when's that going to get done? And also just, I'm sort of confused about the timing here. I mean, this is 13 years ago. I mean, I assume that it's changed a lot in 13 years. I don't know. I can't see that in the document, and I'm not asking for those details, frankly. That's too detailed. But when did we last undertake a review of our compliance with the PEP? Is that an annual thing? I don't think so. Or what? So I guess I'm just trying to sort of get my head around what we're trying to achieve here in terms of doing that assessment. I mean, I think, David, you just started to articulate that a bit. And assuming we should do that, it's best practice. And I guess when will that come to the IJB? Is that going to be done quickly? I mean, this review's only been done 13 years ago, so I'm not suggesting you take another 10 years to do the review, but sorry for being like that, but I just think 13 years to do a review is I'm not quite sure what to make of that.
It was due for review 2015, so that was the review started. Yeah, that was when it was due for review. So the review started in 2017, and during that time there was lots of changes around health and social care partnerships, and that's been the issue with the review of the document. Is it's been like treacle in terms of lots of different organisations going through lots of different changes at different times, lots of people not being able to agree on what the process should be. And then COVID obviously affected things as well. Not that we can blame COVID. So it's every time we've kind of thought we've got there, there's been something else. So for example, this was approved back in August. And then the police, when we thought it was all done and dusted, it'd been through the police governance, and then Police Scotland colleagues said, oh no, wait a wee minute, we've got a disagreement on the warrants, and we've, you know, like, so that took another number of months. So that's just an example of each time an organisation or a partner threw something in, it created more delay in terms of getting it to this position.
David, do you want to come back and give an idea of timescales on the second recommendation and when it could come back to the IJB?
Yeah, so I'm hesitating because I'm thoughtful, and I'm thoughtful about actually whether the right thing to do is bring back to the IJB probably something that is a bit more holistic around the kind of work that is happening from a strategic perspective around mental health, which includes addressing some of the issues that Karen has outlined in terms of access to hospital and things like that, and whether we should do that rather than just something that is narrow, that focus on the PIP. So we can definitely do the PIP bit, but I think what we propose to do is we do that in conjunction with a wider conversation around the mental health and the kind of strategic stuff that is going on at the moment through NHS Lothian. And I would propose that we do that probably within the next 3 months, something like that. And we can maybe even do that through one of the development sessions and have that conversation, because I think it would be worthwhile from a strategic commissioning perspective that members are aware of some of the conversations and the decisions that are being discussed, etc., around that. So happy that we do that, and I can pick that up with the team if that's acceptable, Chair.
It's certainly acceptable to me, and I'm seeing a few nods around. Getting a strategic perspective around mental health and in implications for the IJB, I think will be very, very helpful. We shall leave the operational responses sit firmly with yourselves. I'll let you, don't commit. You said within 3 months, David. Just see how it goes and come back when you think it is right for it to come back, when you have the level of information that will be of benefit to us. So, but I would agree, maybe an hour slot on a development session rather than necessarily a paper. I think that'd be helpful. Fiona, are you happy with, content with that as well?
Absolutely.
Great. Okay, in terms of the recommendations, with the assurance that we've been given, I think we're happy to endorse it. And the second one is for HSCP colleagues to take forward. Karen, thank you. I know it's important that these documents and information is shared across the wider health community. So thank you for coming today and sharing this information.
Thank you. Thanks.
Okay, we move on to agenda item 6. Fiona, is that yourself? Who's going to give us an update on the unscheduled care?
Yeah, thank you, Chair. So we felt it was important to bring back a paper on the monies that we got from the Scottish Government that were invested into the IJB to improve the performance across Lothian. You will remember the background. Last year we brought a paper to the IJB, and I think we put it in as an appendix around the money we got and the funding of what we were going to put it into to try and improve the 4-hour performance at the Royal Infirmary. And I probably sit with 2 hats on here. One is the Chief Officer for East Lothian, but also I chair the Unscheduled Care Programme Board as well. So that we got from the NHS Lothian received 14.5 million at that point in December, and we had a share of that monies, just over 2.6 million, and we focused on putting that into care at home, therapy and social work. We felt that improving these pathways to a home first approach was around was going to be successful for us in East Lothian around influencing the performance. We were keen, if we look at 3.3, we were really keen that we were going to be transforming services, and one of the bold moves we made as a board was from a Lothian board was we weren't going to put it into hospital beds where traditionally we had. We were going to push out discharge without delay. We were going to be transformational around some of our models that were community focused, and again enabling that shift. And again, where we thought actually we can offer a lot through strengthening health and social care partnerships contribution to unscheduled care. So that's why we put it into these 3 programmes. As part of that, we wanted to establish a single point of access for people so that there was a timely access to multidisciplinary input, and that was both from a discharge perspective and also then a kind of front door community perspective. We wanted to create more therapy at home, so moving people out of a bed-based therapy to home-based therapy and wrapping around with care. We also wanted to increase adult social work input. We knew that the good conversations that happen early on influence assessment, timely decision making, and where people end up and getting the skills in the right place. And fundamental to all is the care at home capacity, because we knew that if we could reduce waits for care at home and create care at home, then that would support people in a way to allow them to be close to home or be in their own home and home first. So just a kind of activity update. We have got the single point of access that became live in spring 2025, and then we introduced the community facing single point of access in December. I was nervous about December given the time of year, but we have done that, and that's evolving as we go. So the example of that would be a kind of rapid multidisciplinary assessment as an alternative, that the answer is you go up to the emergency department. How do we support people in the community at the time of crisis? We've grown discharge to success, so much so that they're a victim of their own success in some ways, because we need to put more resource in there. And social work, we recruited to additional posts, and they're involved in the single point of access and the front door work that enable that earlier decision making. And then care at home, we've recruited to internal care at home. And the reason we went internal was just around that reliability in the model of that hospital at home enablement service approach. But as part of the process, we have purchased ours from external providers. So good partners like KinCare, CEDA already provide, but we've done that as part of the slippage to enable the action. So we've done that as part of that process because we wanted to get going. From a performance perspective, it's kind of a story, a 2 halves really. From an East Lothian perspective, we are performing well. We've shown steady improvement across the performance around the indicators. So our bed occupancy in acute has averaged between 79 and 82%. The Scottish Government target is 85%. We work to 112 beds. So Gillian, myself, David, others involved, we know the beds on a daily basis. And I don't know if you remember at the time, East Lothian had a bit of a stretch target of getting into the 70s because we were performing well. So we have held the line, and we have reached that 112 target on a number of occasions. It's just sustaining it as recently as the other week. Delayed discharges we measure as well. So it's both occupancy and delays, in the sense of we want to be under 10% and meeting the target set, so that the delays sitting under 10%, even down to the point of what people are waiting on. So we don't want care at home waits, given we invested in care at home. So our challenges just now are around guardianships. That's a real challenge for us, and a bit around care home placements, but we see a natural shift. But we are sitting under 10%, and on the whole have sat under 10% most of the time. As a positive as well, we've seen an improvement in our length of stay, both across the acute wards. We had a legacy when we first got this money of longer waits. We've seen that reduce significantly, but we've also seen it reduce in our community beds, even to the point the question is, we're saying, actually, do we need to revise what we're taking to the community hospital? Because the complexity and acuity has changed. We're taking more people directly home and supporting through pathways. Do we need to explore, actually, are we taking the right people to the community hospital then that supports that system? We've seen an increase in the number of care at home hours, both delivered by internally by hospital home, but also by providers. And then we've also seen an increase in the number of unscheduled care patients receiving the rehabilitation service. There's less delays for care at home, and then we're seeing more and more people going home from hospital directly than into a care home. So from an East Lothian perspective, that is important that we are meeting the trajectory of what we're doing what we said we do. The challenge we have from a Lothian-wide perspective is the 4-hour performance target. While it improved in the January to July of 2025, and we saw reductions in the 8 and 12-hour breaches, so that long waits, and we got the performance up into the 60s and in the 70s on days. We have never reached that target into the 80s, and then from the summer through to December, we saw a deterioration, and that's the challenge that we are seeing, that the 4-hour performance is not impacting in the way from a system-wide, because while East Lothian has done well, there have been challenges around Edinburgh getting to the target and Mid Lothian getting to the target, and Mid Lothian have come close on a number of occasions as well. So we need to see that system improvement. So just from a system though, it is important to say the metrics of length of stay has reduced by 9% as a system, non-delayed patients reduced by 18%, new delays added per day is reduced by 12%, the occupied bed days, they've reduced by 38%, the overall bed days reduced by 8%. The challenge comes as the pressure point of the attendances and new patients coming. There's been an increase of 8%. So while system performance wise, we can see improvements in a lot of the metrics, it's not tailing into the 4-hour performance that we would want. So we continue with, and some of the challenges as well that we've seen across the system is we've had workforce shortages around the RACU unit in the Western General, so that shifts around attendances and what they can take in a planned way, so that's often a lot of GP flow. We've seen higher A&E attendances than the previous year. We've lost care home beds in Edinburgh suddenly that we didn't plan on, that impacts on beds. So we continue to meet as a system 3 times a week. We continue to focus both on the back door and the front door, and we've extended it further into the Western General and St John's. At the time, there was engagement with a number of stakeholders that we facilitated through partner meetings at a senior level, and I've mentioned we still have the meetings going on. One of the things when we came to write this report, we recognised that there was not a Lothian IIA done at the time, because actually we put the money into different activities to improve the performance, but we are keen that an IIA is planned for the single point of access, as that kind of represents more of a significant change to service delivery, and it gives that insight to inform that ongoing development. So if I go back to the recommendations, I'm keen that you as an IJB note the performance as a result of the Scottish Government investment. I'm keen that you note East Lothian's contribution to the improve unscheduled care performance through the delivery of that home first approach. And I also, and it's a question that we're asked regularly, note that the funding, both non-recurring and recurring investment, to support that kind of sustained improvement in unscheduled care. And when I talk about that, I talk about the slippage that has come that we have put into care at home to make it sustainable. I'll pause there, Chair.
Thank you, Fiona. And we agreed a couple of meetings ago that it'd be good to get this update. So thank you for providing this. So I'm going to open it up to any comments, questions, observations. I have one first, and it's kind of on that last point you made. Are we as an IJB and HSCP exposed to any risks should Scottish Government say maybe this hasn't worked as well as they we were anticipating?
Yeah, so that is the concern. And at the time, remember, we'd asked NHS Lothian said that they would support that underwriting because that was a concern for IJBs to sign off. What would the outcome of that be if Scottish Government stop funding it? I think the challenge for us, and that's why we were taking the slippage monies, is the sustainability impact of how do you keep sustaining when we're managing that demand and you're seeing it through the front door. So if we don't continue to use the sustainable, and we're all agreed as a team, we're putting it into care at home, because otherwise we would need to stop care at home and that would have impact. So the non-recurring funds, and we're taking every opportunity to shout for it, every piece of money that's going, that we're putting into that. But yes, there is a risk. There's a risk around, we don't know what will happen just over the next few weeks around May. But last year, NHS Lothian did say they would mitigate against that risk, because that was a concern for us as an IJB, particularly around our finances at the time last year. And then the use of the non-recurring we're using to bolster and continue and do the right thing, that will be a risk, and it means that we may have to stop some of our commission providers if it came to that. But we're not there yet, because we're still using the funding appropriately.
And this wasn't a randomized controlled trial of comparing additional hospital beds as opposed to this. I mean, the risks would have been whatever. I personal here, I think if we'd have put all of that money into additional hospital beds, I'm not sure that would have had any impact whatsoever for our performance. But we haven't done that trial, so anyway, that's me hypothesizing. Shameen.
Yeah, no, thank you. You've kind of asked a question already around the sustainability of this, Fiona, as we move forward, because I think if we were to pull back on some of these things, it just wouldn't we wouldn't be able to meet the delayed discharges. So it kind of covered that. I just wondered if you're able to kind of give a breakdown of the East Lothian's allocation. We got additional 53.8 WTE staff across a number of teams, and I just wondered, it might be something you could come back on, of kind of where those teams lie, and kind of where on section on 3.5, kind of where that resource was allocated on those areas.
Yeah, so a broad kind of update. The majority of it went to care at home, hospital at home team, around the resource, then followed by therapy, and then by social work. And I was really keen, I think at the time Isabel might come in, to make sure that we had that the multi-professional approach, because we all agreed on care at home, and we're pretty fixed as a team, but also the importance of these professional roles within that, because we know that these are the people that make it happen. So majority care at home, followed by therapy, and then followed by social work. Do you want to come in on that, Isabel? Oh, you're on mute.
I think I'd have got it, but now we all agreed that it should go into care at home. A lot of it should go into that, but equally 85% of the calls that come into SPOA are for therapy. So that's a huge amount of demand on the therapy services. So, but there was also a need for social work involvement within it as well, because we offer a different perspective, and so often we go out with therapists, and and there's some things that we'll pick up on our own. But that was the kind of 3 areas where we decided that it should go: community care at home, and then the next chunk to therapy, and the next chunk to social work, based on what we needed to cover it.
Andrew, if I can just come back on your point around the beds, and I've not rehearsed this, but I think from an East Lothian perspective, we're in a place that we do feel, given our performance, we have more skin in the game, in the sense of being able to negotiate what we think is the right thing to do, and we've got credibility, I think, where it's not that we've not had it, but we've got confidence from acute teams, and we often hear on our weekly meetings, well, if everybody could be like East Lothian, and now everybody can't be like East Lothian, because we're not all set up the same from the starting point, but I suppose as a team, we would be clear on, actually, no, we wouldn't be doing this, and we wouldn't be putting money into that, because we believe the right thing is the community, and we've shown the art of the possible. How do we engage that further? So some of the discussions were happening around, how do we enhance some of these pathways even further? That means that the only option isn't an acute hospital bed. So I think there's a confidence, and people are willing to work with us on that, just around that direction of travel. whereas before I'm not sure we would have had enough muscle weight to influence that. We've now got the data that supports that.
Thank you. It's just something you can come back on section here. It talks about higher A&E attendances compared to the previous year, but that might be something that you're delving in on to find out why that's happening.
So I think the challenge is we don't know why that's happening, and that came up in our meeting today. It's a national issue, so it's not just Lothian. I think the challenge is it some of the work around primary care? Is it a bit of culture around the public? People are not willing to wait in the same way that they were waiting before. Are we clear on our systems and processes around that prevention end? And we've done work through a day of care audit as part of this unscheduled care monies of, are we getting the right people turning up, and are the people coming in needing to come in? So further work has been done on some of the minor injuries pathways, ambulatory care. What actually needs to happen in an ED, or could we explore elsewhere? But it's a national issue around attendances, and we're digging even deeper. Jamie's doing a bit of work as well. Is there anything around any of our East Lothian practices? Because sometimes it does feel like a bus comes from East Lothian. We think we're on it. A bus comes from East Lothian, and they're all in the Royal Infirmary or the Western. So it's a challenging question.
I think I asked that question in my first A&E operational job in 1994. So why have A&E numbers increased? So it's been going on for a very, very long time. And when you get the answer, Fiona, tell me, because I'd love to know. But sorry, that very flippant. But Elizabeth, over to you.
Thanks, and thanks, Fiona, for that report, and also well done to the team, and obviously you with your two hats on, and then to everybody in East Lothian for their sustained work in this, making the progress that they have. I just wanted to ask, in the report it mentions the pressure point of the increase of 8% in new inpatients per day, and I'm wondering, do we have an understanding of why that is happening?
So some of the thought is these were the people who were in the queue before that weren't getting into beds, and they're now getting into beds in a way that they weren't before. And when they're in the beds, they're in for a relatively short period of time, and then they're back out of the beds. There will be a mix in that of those who are attending, and while we've got pathways in for some, we don't have others, and to deliver that care in a bed is quicker and thorough than discharging them. So that's some of the thinking around that increase around admissions, and that's I guess the question we asked when we did the day of care. Wait a minute, we've got this bit right, and now we're seeing more people coming in. So that's when we did quite a large audit of admissions, and then we did it of attendances as well. There's culture is definitely in there. And that's something we've picked up on. People are not willing to wait in a way before, but I'm confident that everybody being admitted is being admitted for the right reasons, because we have been through that.
Thanks.
Okay, Fiona, thank you. I think that's been a helpful and needed update. It doesn't end because of the update today, and I know your efforts will continue in this space. But I think maybe bring this back in 6 months or so, just to it doesn't have to be a paper, but we can have a verbal update on continued improvement, stroke developments in this field. So thanks, Fiona.
Thank you.
We'll move on to our last two papers, which are around our offers and budget. So I'm going to hand over to Mike for agenda item 7, just to take us through the funding offers from our partners. Mike.
Thanks, Chair, and good afternoon, everyone. So the purpose of this paper is to set out the funding offers that we've received from our partner bodies for the 2026-27 financial year, so next financial year. And around this time every year, East Lothian Council and NHS Lothian write to the IJB with their funding offers. East Lothian Council had their budget approved in February, as I advised the IJB at the last meeting, and they have provided the IJB with a final written funding offer. And NHS Lothian will take their updated financial plan to their board in April, and following that, they will provide the IJB with a final written funding offer. They have, however, written to us in the interim and provided an indicative funding offer at this point in time. So this paper assesses these offers to try and ensure that they are fair and reflect the Scottish Government guidance in terms of how they allocate the funds. I'll move to the table at the top of page 2 that sets out the council offer, and then below that there's a brief explanation of the different elements or the individual balances within that offer. I just wanted to remind everyone that the figure at the top there, the 81.53 million, now does not include the 1.494 million relating to other delegated budgets that we had in our budgets at the start of this financial year. That has been returned to the council and it's no longer a delegated service. So if you're doing comparisons with last year, you'll need to remember that that balance is now out of there. The council offer is fair and it does meet all the Scottish Government guidelines in terms of passing through the funding that they've received. With regard to the NHS offer, and that's at the top of page 3, in the table at the top of page 3, the indicative offer does not include the 2% uplift that was announced in the Scottish Government budgets back in January for health boards. But within the body of the letter, the NHS Lothian have indicated that they will pass that funding on to us. Now, usually when that funding is announced and NHS Lothian bodies or NHS bodies receive their funding letters, it advises the NHS body that that funding is expected to be passed on to the IJBs, or the share of that funding is meant to be expected to be passed on to the IJBs. This year the letter didn't say that, but NHS Lothian have decided to pass on the funding to their 4 IJBs. So just to make that clear to everyone. And I will undertake to bring back the final funding offer from NHS Lothian as and when I receive it, and we can look at that in its entirety. That's all I really wanted to say about this paper, but I'm happy to take any questions if there are any.
Okay, great, Mike. I think you said it there, you are content and that both funding offers reflect Scottish Government guidance, and I think we should acknowledge our partners for reflecting that and making those offers. So I'm sure when we come to make a decision, we'll reflect that. Shameen first.
Yeah, no, thanks. And thanks, Mike, for all the work that's gone into putting the paper together. I was just wondered on top of page 176, just up the table above 3.5, the share of additional 2 million for social care. I know I keep checking with Ellie and finance if anything has come through for us in East Lothian. I just wondered if there's any update on that, because it's still blank. Maybe it's not been given any indication yet.
Sorry, could you see the page again, Shameen, and I'll just get to it?
Yeah, it's just the table above 3.5, and it has. Yeah, just the share of additional 20 million for social care. That's still to be confirmed. I just wondered if you had any indication of.
I haven't got that. I haven't got that yet. No,
got that yet? Okay.
I haven't seen that yet. But as soon as we have it, we will make it available to everyone. Once we know our share.
That's grand. And just on the back page on the NHS one, I just wondered if, just for clarity, this figure does not include the GMS uplift. So does GMS get a separate uplift to everything else?
Yeah, GMS includes the GMS figure, but GMS is a non-recurring fund. So the NHS bodies get it every year as a separate allocation. But we have or NHS Lothian have included it in their offer letter because it's assumed that they will receive it, but we don't know what the uplift is on that yet. It gets a separate uplift from the baseline funding that comes to NHS bodies.
Okay, thank you. And there's just one other comment I just wanted to add. I think it'd be helpful just to include in there's the digital to analog, because that's quite a big issue for us. There's while we don't have any capital funds, there is resource allocated to change from analog to digital. So I think that's helpful to include that in there if you can.
Okay.
Okay, I'm seeing no more hands. Oh, sorry, Laura.
I may be able to take it offline. I'm not sure about digital to analog, because obviously we don't have that within our.
No, I mean, I can include the reference to it, and if there's anything that affects the services that the IJB delivers, then we can reflect that in future papers, if that's okay.
Yeah, that'd be helpful. It's a number of things have made reference to the offer letter of analog to digital, core and cluster housing. I think it's just useful to recognise that while we don't hold any capital funds, we are getting support in other ways. While it's not directly in our budget line, we are getting other supporters.
I'm sure, Mike, you will think of an appropriate set of wording when it comes to final budget papers, etc. So, Maureen.
I thought it was number 3 there, Andrew, and I kind of switched off, sorry. Just round about the budgets, Mike, has there been any consideration within the budget about the sustainability of the third sector? Obviously, when we're looking at early intervention and prevention, the community support stuff, and I don't mean community support service, I mean in general, the community support that is given within our communities that we live in, not the community support at GP level. Is there anything in this funding envelope that we could look at, basically?
Is that more for the next paper, Mike, rather than this one? Or?
It probably is. These are setting out the funding offers.
Right.
I mean, the connection I can make is that if we have any discretionary funding that we can look at, then that would be where it came from, unless there's a separate allocation that gets passed through to us for anything like that.
So there's none. Perfect.
There's
okay.
not there's not a separate allocation.
Yeah. Thank you.
So hold on to that for the next paper, Mike, and if you need to comment on that.
Yep.
So let's just take this one here. There's 2 recommendations. One, to accept the East Lothian funding offer, and to note the NHS one, and then once the final offer comes in, I'm sure we will accept accordingly. Are people content with that? I am seeing plenty of nods and thumbs up, so yeah, we'll take that one as accepted. Thanks, Mike. So move on to the next one, which is the proposals for a balanced budget for the financial year that starts in a few days.
Thank you. So the purpose of this paper is to present the budget setting process to the IJB, to propose that the IJB sets a balanced budget for 2026-27, incorporating the efficiencies that we've identified and the collaborative working that's set out in the paper, and to provide the IJB with an update of the medium-term financial projections looking ahead. In terms of background, the IJB will recall that the February finance report highlighted that in quarter 3 we had an overspend of 1.25 million in health delegated functions, and an overall forecast overspend for the IJB of 1.8 million. The month 11 position has updated that, and the forecast overspend has risen to 1.9 million, and that primarily sits within the set aside services, but there also is a significant overspend within our prescribing. So I confirmed that NHS Lothian will support that the IJB to a break-even position for 25-26, but what I wanted to do was highlight the current challenges that this brings to light in terms of the IJB managing its financial position and dealing with the demand and growth pressures on its services. And we know that these challenges get greater as we look ahead as we look further ahead. So we've had a number of development sessions throughout the year, and latterly we've focused on identifying the financial gap for 26-27. And we've identified as well a broad range of grip and control and invest to save efficiency schemes to try and address that financial gap. The next section of the paper provides the detail on the budget setting process, and that takes us to the table at the top of page 2, which sets out the workings to identify the funding gap for the coming financial year. So the top section of that table identifies the additional expenditure that the IJB expects to incur in the coming financial year, and the bottom section, any additional income that it expects to receive in the coming financial year. We set it out by the 2 funding bodies. It's a familiar approach that we've used, so hopefully everybody's comfortable with what we're trying to say there. You'll see that there's additional costs around pay awards and pay increases and growth and other commitments which relate to, in health, will relate to things like prescribing and non-pay pressures, and within the council will relate to the real living wage, free nursing and personal care, and other pressures in the commission services. In terms of the income, you will note that we are getting full funding for our pay awards for the coming financial year across both providers. We've also got policy funding from the council around the real living wage and free nursing and personal care, and both bodies have passed on additional funding in terms of pressures and growth. From the health perspective, that's a 2% uplift that they've received, and from the council perspective, they have identified 350,000 and passed that on to us. So all that comes back to a gap of 3.743 million, which you'll see at the top, at the bottom of that table. The budget setting process then takes us on to identifying a range of efficiencies, which we've done, and we have identified in our core services and across our hosted and set aside services. And these are summarised in the table on the next page, where you'll see it set out. The schemes totaling 0.6 million within the council delegated services have been identified. They fully fund the gap and then enable us to present a balanced budget position for council delegated services. In terms of the health delegated services, a gap remains, and that sits entirely within the set aside services. Paragraph 3.12 in the paper sets out the approach to dealing with the remaining gap, and I'm proposing that the combination of efficiencies identified and the shared ambition and collaborative working highlighted in 3.12 will enable the IJB to set a balanced budget for the coming financial year. I would add that paragraph 3.12 indicates that NHS if NHS Lothian break even, then they will support the IJB to break even. At this point in time, NHS Lothian's financial planning indicates that they are anticipating that if they deliver their 3% savings target in full, then they will break even. And at the moment, they haven't identified that savings target delivery in full, but they have gone a significant way to identifying schemes to deliver it in full. So there's a hope that will be achieved as early as possible in the coming financial year. The paper then goes on to set out a number of risks arising from the budget setting process, and it highlights any mitigating actions that we've been able to identify in dealing with those risks. We'll just touch on each of them as briefly, if that's okay. So in terms of the efficiency, just to highlight again, the efficiency schemes have been talked about at development sessions. They've been highlighted, and the risk of those schemes has been identified as low or medium. So on that basis, I would hope that these schemes are approved. In terms of the financial risk, there is a financial risk there that we haven't touched on before, and that's around the agenda for change reform. That's a risk that NHS Lothian are now recognising based on what they expect the cost of those reforms to be against what they believe they are going to be able to be funded for. So I wanted to highlight that because whilst that risk sits with NHS Lothian, the implications of it will be on the partnerships in terms of not having enough funding to deal with what the agenda for change reform is dealing with, which is the reduced working week, the band 5 to band 6 regrading and protected learning time. So it's just to highlight that. In terms of the prescribing, that continues to be a challenge for us and it is a pressure going forward, but we are doing what we can to mitigate that around our Invest to Save schemes. I suspect that if the current climate across the world continues, then there will be other factors that will impact on prescribing around the cost of drugs and availability of drugs as well. So that may be things that we will have to deal with on top of the financial pressure that we've got at the moment. In terms of the demographic growth, just to highlight that we have got ongoing reviews in our community services and our care at home delivery model in particular. In terms of resources, we are focusing on the prevention and early intervention, particularly around frailty, and we also have a vestibular prevention programme that we are looking to pilot. If those schemes deliver in terms of outcomes, then these are things that we will try to put in place going forward. But at the moment, they are just pilots. In terms of the strategic risks that we've talked about, is again just to expand on the collaborative working. Our chief officer and our head of operations are regular tenders at cross-party groups within the council. So we have good relationships and we're working closely with our council colleagues in that respect. The paper just goes on to provide an update on the IJB medium-term financial projections, which are set out in table 3 at the top of page 5. And you can see there that the cumulative projected position is about 22 million by the time we get to 2030-31. Now that is based purely on the information that comes from both our partner bodies' financial plans at this point in time. It doesn't reflect any efficiencies and it doesn't reflect any scenario plans. And you may recall that we have started to look at scenario planning and we'll continue to do that into next financial year. But at this point in time, these are just the straight numbers that come from our partner bodies' financial plans. So the projections do highlight that we do have significant gaps going forward year on year. And again, it just brings us back to the fact that we need to start planning now and we need to start delivering transformational change where we can. That's all I wanted to say, Chair, at this point in time, but happy to take questions.
Great. Thank you, Mike. Let's open it up for questions, comments, observations. I'll start, Mark, if it's okay. Just on the efficiency schemes. Yep. We don't see the detail as the IJB, but we do. So I just an opportunity for you and colleagues to assure us that the delivery of those won't impact upon the quality or the volume of services. They are purely within the HSCP efficiency, and they're not going to impact on the delivery of services.
No, that's the case. I mean, we have made sure that that's how we've looked at them as well. They are going through integrated impact assessments as well, just to make sure that some of them will require these assessments, but as far as we're concerned, they don't have any impact on those things. No.
So none of those will come back for a decision for the IJB to make, essentially.
No, this is I'm seeking to get approval as part of this budget setting process that these schemes are good to go.
Next, Jonathan.
Yeah, on that last point, I mean, well, that point, it's sort of an oddity, isn't it, of the format we get presented with. We have no workforce assumptions in this paper, and I know that's how the information comes through to us. I find that difficult to assess, given that probably 50% plus of our cost is workforce, and yet we have no information on that. We never are presented with information on that. So I can only assume that the budget is presented on the basis of a status quo, business as usual, same, stable workforce. And I mean, that's the first question. I guess maybe my assumption is wrong there, and building how that's modelled. But just on efficiencies, that point there, Andrew, actually, when you look at the efficiencies, I mean, I can broadly add up the £700,000 or £800,000 of efficiencies are staffing related. So I come back to ask a similar question as you did, Andrew, about what does that mean in terms of, does that mean what does that mean in reality in terms of our staff and service delivery when we have efficiencies of that quantum? The prescribing one is a serious risk, and that's well set out. I mean, we have £1 million of prescribing efficiencies there, and we know what's happened on drug costs. And unfortunately, I think that's only going one way still. So I don't know. That's a difficult one to manage. You know, and finally, I suppose it still is, how do we link this in with what we talk with our strategic plan? I mean, it's sort of, I don't know how else to put this. It's almost like cart before the horse, because we have our strategic plan, but the budget's been done seemingly, you know, not with that in mind, or not really building in what we might be doing, because we haven't actually worked out what we're going to do yet. So I don't know if that means really for 26, 27, what we're seeing here is business as usual in terms of service delivery and service design, because presumably by the time we get around to actually working out what we may need to do different based on our 26 to 2030 strategic plan, it's probably too late for this year anyway. So I just want to have a sort of honest understanding of that, what it means for us in terms of what the service delivery is going to look like and configuration of the services this year. So if that makes sense as a question.
Yep. So
thank you.
I wouldn't say it's the same again, because we are looking to make changes where we can, particularly around the invest to save work that we're doing. Looking forward, we at the last development day, we got approval to work up some of the bigger transformational schemes that we've been talking about for a while. So that work has started, and that is what we expect to progress, and that's what we hope will start to make an impact in terms of delivering transformational change. And as that progresses, then we obviously need to keep the IJB updated, and particularly around the development days. So yes, there is no transformational change in this coming financial year based on the efficiency schemes plans that we've put in place, but we are working on the ones that we discussed at the development day and that we want to take forward. So I hope that answers that part of the question.
Can I just, I agree. Yeah, I do. But I think the nuance in terms of the risk piece is not, to me, when you set out the risks earlier, I sort of think that the strategic risk is the biggest piece of this, in a sense, and it's not around efficiencies, it's around the whole spending envelope, whereas the risk written here is just narrow in terms of efficiency. So to me, one of the biggest risks we have in this plan is that we need to build in the strategic change and transformation that we've been talking about, and you know, and prevention and community, etc. So I sort of feel that shouldn't, you know, I almost feel we should elevate that as a risk here in terms of the overall risk. And it's not about, to me, it's not about efficiencies, it's about the overall plan in terms of that overall strategic risk. Sorry, if that makes sense. Yeah. Then the second bit, so that's fine, but that's my comment on that, Mike. And the second bit was about workforce, really. So
yeah, I mean, the detail of the workforce is more of an operational matter, as I would have suggested. We don't routinely bring workforce information, but your comment around the efficiencies in terms of workforce, we have made sure that those don't impact or on any services in order of service delivery. So a large part of that, almost half of the 800,000 that you talked about was around supplementary staffing. So that's us looking to bring down our bank and agency use, which we should be doing, whether that's through recruitment and making sure we've got a more stable workforce, whether it's management around sickness absence or whatever. But that's a target that we set ourselves to bring that usage down. So that's one factor in there. It's not around losing workforce, active workforce.
Yeah, that's the important thing, right? I totally understand not getting to operational detail, but I don't fully agree in terms of presentation information to us as an IJB if we don't even know the high level workforce assumptions. But I think That's all. I'm not asking for detail. I'm just asking for overall assumptions in terms of workforce, numbers. I mean, based on efficiencies, it would imply it was reducing, but it's not what we're saying probably. So that's all I find it odd given that's half of our cost, that's all. And we should have an understanding as an IJB what our overall workforce numbers are going to be, whether they're increasing, decreasing, what impact of retention. That's all I'm asking for. I think that's a reasonable request.
Okay.
I don't think that stops us agreeing the budget, but I think it is a reasonable request as we particularly go into the more strategic changes. And we are caught between the rock and a hard place of we are a strategic planning body, and yet we're approving budgets, and the budgets are 80% staffing, and we have so it's a very difficult circle to square in terms of making approval decisions. And I think I'll ask Mike and Fiona and colleagues that as we develop the work over the next couple of years, workforce is absolutely included in that. Fiona, do you want to add anything on that before I move to Shamin?
Yeah, helpful comments. I guess a couple of things that I was going to come in. Workforce, I suppose the challenge for us is we know, and part of the work on the over recruitment to nursing is we know workforce is going to be a challenge. So we need to make a provision for that, because the workforce, we're going to have less pool of people. Where we deliver our services will be different as well, because and I suppose this is a bit I'm picking up around the transformation. We are doing it in East Lothian. Remember the difficult decisions that we had a few years ago around care homes and community hospitals. Look at the unscheduled care paper of bringing more people closer to home and delivering care, the expansion of hospital at home. What else we are going to keep bringing? We are doing it all the time and evolving, and it's through some of these tests of change. I think the other uncertainty is digital. How can we use that to play to our strength and the governance attached to that? But I guess just the other thing, Jonathan, and I wondered it would be helpful for an IJB, set aside is a massive pressure for us. And I do wonder if it's worth the Michelle Carr and Nick, and I've totally had a mental block on his surname, coming and speaking to the IJB and set aside around that financial process, grip and control, because that might be quite helpful in the context, given a huge pressure doesn't sit with us to directly manage. So I don't know if that would be helpful, Jonathan.
I'm going to say it is helpful. It's anything that ultimately gives us information to make informed decisions for the medium-term plan is going to be helpful to us. But
and Nick Bradbury, don't tell him I forgot his surname. It was a moment of thought.
I didn't know his name to forget, Fiona. So you're forgetting.
If only we were recording this, Fiona.
John, I think you make some really valid and these are consistent comments that I think we all, and particularly this year to me is the last year before we get into some of the more challenging conversations, and the level of financial information and staffing and supportive information that we'll need to make informed decisions as IJB members will need to include staffing and all of the associated costs that around all of that. So that's a plea from members, Mike and Fiona, that when we come to those decisions, we get the right information to be able to base our decisions on. Okay. I'm going to move on, John, and invite Shamin.
Yeah, no, thanks. Fiona, you kind of covered the set aside, and I think it'd be great to have a session on that, but making sure that we're looking at it in a whole system approach in an integrated way, and that we've got all the right people together in the room to be to look at that. You covered the kind of set aside of being able to see progress on that, and it's something I might be able to come back on is the assumption, then the estimates that have been made both by health and the council. It'll be useful to know what they're using to come to these figures, that we get to 15 million in 2030, 31, and what detail they're using for that. And just for clarity, my understanding is from the council side, we've been allocated a budget for 1 year, and from the NHS side, Mike, I think that's just for 1 year as well. When we were talking about sustainability, so that was my understanding, that it's just been for 1 year. But I know Scottish Parliament had been allocated a budget for 3 years, so we can only go by what we've got for that year, is my understanding. But you could just give me clarity on that, Mike.
Yeah, That's my understanding. It's a 1-year budget for both organisations at this point in time. In terms of assumptions and estimates, they largely, they do reflect Scottish Government guidance at the time. But I can get the figures for you if you want to see them.
I think that's something to include in our development sessions, Mike, just so we're all clear on that.
Yep.
Maureen, last hand up.
Perfect, thank you. I'm kind of repeating exactly what Jonathan said. And Shameen, I would really like us as an IJB to have some kind of mechanism to ensure that these decisions that we're making are reflecting the strategic plan, especially their commitment to prevention. I still feel that we're being reactive and crisis-led. So is there something, I mean, I don't know if, does other areas, is there a tracking mechanism that we've invested this and the impact's been this? And, you know, because I feel that we're kind of Groundhog Day and we're on maybe year 2 or 3. And I don't see, I mean, I know that we've transformed Summit, but maybe it's just me being me. I don't think we've went far enough because, again, we're still stuck on the statutory services. I didn't see any real investment in community services, third sector services, and I know that you do support them in various forms, but actually, where is what proportion the budget would be or could be allocated to those services? That's what I would like to see, Mike. Because we have to do it all together. And if we keep doing the same thing, we're going to get the same response. Sorry, thank you. Fiona?
Are you okay, Chair, if I come in?
Yeah, no problem.
I think that's a fair challenge, and yeah, the majority do go into the statutory services that we are required to deliver, but through some of these kind of efficiency schemes, we're trying to move towards actually how do we get into that prevention space. It probably doesn't go far enough at this stage and at the pace we want it to go at. So I think that is fair comment, because we're constantly balancing some of the, I guess, the statutory, the risk, the performance, etc., on how we are measured. But we have done, and Mike, we can pick it up, we have done the tracker around some of the unscheduled care work. Where could we extend that to further? And I suppose the other thing, just to add, the relationship and the conversation with our partners is just so much different going forward than where it was. So, you know, Sarah Fortune talks about actually the transformation funds there. How can you as an HSCP tap into it? So there is a willingness and an opportunity that we do need to do it together as a whole system, and we can't just do it on our own. So, but I think that's absolutely fair around where we are putting the money and how do you shift the tanker.
Yeah, how do we know that we're actually making any inroads into it?
Yes.
I would like to see some kind of tracking on that. I think that would be really helpful.
Yeah. We can look
Thanks,
at that.
Fiona.
Mike, anything to add on that?
No, not at this point, thanks.
Okay, so I'm seeing no more hands, and Mike, Fiona, there's lots of questions. I don't think they prevent us from supporting, or certainly don't prevent me from supporting the recommendations, but this is the continued work over the next year to get this alignment between the strategic plan, information around staffing, information to allow IJB members to make informed decisions. All of this is work in progress. But let's come to the specifics, because it is important. We are at the point of approving the budget. Are we content to agree the balanced budget that Mike has set out and support and approve the efficiency schemes that have been detailed with the assurances that Mike and Fiona have given us? Are we content to do that, colleagues? I'm seeing thumbs up and nods and things. So, Mike, I think we acknowledge that it's an important thing. It doesn't stop all the work from taking place, but it does allow us to mark the end of this financial year with the agreement of the budget going into next year. So, thank you, colleagues, for that. So, we've come to the end of the agenda. I think Rebecca's going to tell me I missed my chair's report. Is it, or is it something else?
Sorry, it was just to check that you were happy to record that as that there wasn't an update to give.
There was, I just forgot it, and I'll just briefly say that the only meetings I've attended were an IJB chair and vice chairs network, where there was some very helpful information that came out around primary care and overall IJB finances. The papers for that have come through. There's a couple of presentations that Becky, I'll get them to use to share around with colleagues. I think it is useful for colleagues to see, particularly on the finance, that many other IJBs will be not setting balanced budgets for next year. And I think I do want colleagues to see that where we do sit within the overall scheme of IJBs and how well we perform on some of the financial indicators. There's also some interesting information around primary care. John isn't here, but I'll get those slides sent round. And the final one was that there was a letter that's come through from the National Care Service that's around some standards. I haven't read it yet, but again, Becky, I'll ask that to be circulated to colleagues, and we'll pick some of those issues up at the next IJB meeting. So apologies for missing that out on the agenda. I've got two further hands, so Fiona first.
Yeah, just following up from, I think, Shameen, your question at the very start around the weight management regarding the paper. Laurie Isles has been in touch. She's going to formally respond to me from in our Scottish Government role. She has raised it with Scottish Government. She's going to come back to me and was delighted that we were still enthusiastic around that follow-up. So I'll make sure that's shared around the IJB, but she has been back in touch.
Thanks, Fiona. And David?
Thanks, Chair. I just trying to perhaps overinterpret what you said there. Is there a danger that those IJBs that actually manage to set a balanced budget and go through the pain of doing that will be disadvantaged, as those that are able to do it will be bailed out?
I am picking up no indication from what I see that there will be bailouts. They will be having significant financial challenges to make, on the back of that, some very challenging decisions around the configuration of their services. So, however, I'm not an expert on other IJBs, but I think your comment is useful to interpret, David. But being massively overspent and not setting balanced budgets is not the panacea that many people think it is, that there's some magic bailout to that. It never happens that way. That's my experience. But I will get the papers circulated and I'll let you draw your own conclusions from what you might see in the papers. Okay, thank you. My voice is just about held up. So, and also you might have noticed the dog's demanding to be taken out as well. So I better head off. So thank you, colleagues. We meet after the elections on the 28th of May, but we have some development sessions along the way in between that day. So thank you, everyone. Constructive and helpful conversation as always. Take care.
Thank you.
Thank you.
Thank you.
Thank you.